When I talk to families about their baby's HIE diagnosis or subsequent CP brain injury, I hear labor and delivery stories from all over the country. Some mothers, they will describe a team that was engaged with them, that was responsive and ready to act. Others will share moments where they felt unheard, where their concerns seemed to just be brushed aside, or it took too long to make decisions that they felt was in the best interest for their baby and for their family. A safe labor is not just about what goes wrong, it's also about what goes right. And so today what I want to do is I want to talk about some of the good signs of labor that labor and delivery that we look forward to seeing, the things that show that the medical team are doing a good job and that the baby is handling labor in a safe manner. As a birth injury lawyer, I see both sides of this. One of the biggest factors is how well the doctors and the nurses, how well they listen to moms. You know your body. You know when something feels off. The best medical teams do not dismiss that. If a mother says that something is wrong, they take it seriously, whether it's an unusual pain or reduced movement or just a gut feeling that something does not seem right. Good providers will respond to it and they will not ignore or brush mom to the side. Support matters also. Beyond the doctors and the nurses, having a family or a partner or even a doula in the room can make a big difference. Labor is intense, and having someone by your side to speak up when you need them, to even help you stay calm or to just hold your hand, all of that matters. And then we have things like the fetal heart rate. That's one of the biggest indicators of how well your baby is handling labor. When things are going well, we want to see stuff like accelerations and good variability. And those are changes in the heart rate that show that the baby is well oxygenated and responding normally. When the pattern starts to change, when there are deep or prolonged dips or a steady flat pattern, that can be a warning sign. That is when medical teams, when they need to act for you and your baby. And sometimes waiting too long is exactly what happens. A timely C-section can prevent serious harm, but I've spoken to families where doctors have hesitated, trying to still push for a vaginal delivery when all of the signs are pointing for a need of an emergency C-section. A baby that's in distress, they can't wait for second guessing. The decision to move quickly should be made, and delays can mean deprivation of oxygen for your baby. Now, once the baby is born, one of the best signs that we want to see is a strong first cry. That first cry, it can tell us a lot about your baby. It shows that the baby's lungs are working and that oxygen is reaching the baby's brain and other parts of the body the way it should. A weak cry or no cry at all can be a sign that something may have went wrong. And mothers, they also need good care. Labor is physically exhausting, and medical teams should be monitoring for things like excessive blood pressure excessive bleeding or high blood pressure or other types of complications. Pain management should be available and respected. And emotionally, a mother should never feel like just another patient on a doctor's or a medical professional schedule. She should feel heard and cared for. And lastly, with all of this, right after birth, skin-to-skin contact, close contact with the baby, and monitoring will help babies transition. It's a time where doctors should be checking for immediate concerns and making sure that the baby is adjusting well outside of the womb. Labor and delivery, it is very unpredictable, but good care is not. Strong communication, proper monitoring, and timely decisions, and a baby who shows these types of good signs, all of these types of things can lead to better outcomes. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury or subsequent CP diagnosis, from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile. You can find out my contact information there. If you're on certain apps, you can send me a DM and we could chat for a little bit about what's going on with your baby story, or you could just wait and watch the picture that follows this video. All right, that's going to be it for this morning's quick educational video. Have a good day, everybody.